What comes along with people back injured when they can't do that thing that they love? Depression and back pain. What are my thoughts? SRIs and SNRIs. The side effects are crazy. And what happens when someone is depressed? They have this posture. For those that don't know, my name is Brian Carroll. I live in Jacksonville, Florida. I'm a McGill Method certified provider, having power lifted for over 21 years and ending on a high note of being the first person to squat over 1,300 pounds. I now work with people all over the world from both a virtual standpoint and in person here in Jacksonville, Florida, with injury, resilience, and performance enhancement. I'm not giving you medical advice. For more information, go to poweractstrength.com. Thank you so much. Enjoy this video. Depression and back pain. What are my thoughts? What comes along with people back injured when they can't do that thing that they love? What happens? Well, they start to get depressed. They get depressed because they can't exercise. So instead of treating the person, and I've already made the videos on what a spondylitic fracture is, what spondylolisthesis is, why a surgery failed, why these types of surgeries do fail. Check out those videos. We'll link them below. Depression is a real thing when someone is back injured. Now, in some ways, some of these drugs that are prescribed from your general practitioner or pain management doctor, whether it be Percocet or gabapentin or antidepressants, SSRIs and their cousins. So when I say cousins, so SSRI is selective serotonin reuptake inhibitor, and SNRI is serotonin norepinephrine reuptake inhibitors, are two types of antidepressants that help treat depression and anxiety by increasing levels of neurotransmitters in the brain. SSRIs primarily increase serotonin, while SNRIs boost serotonin and norepinephrine levels. I've been prescribed both of these at times for nerve pain long ago. SNRIs are typically better for nerve pain in my experience with my clients, and actually some of the research shows that it's more effective for nerve pain. At least Lyrica and Cymbalta, duloxetine, Lyrica and Cymbalta are more effective for nerve pain than actually depression. But there are side effects that we're going to lay over about these drugs, whether someone is getting on. Sometimes the nerve pain worsens and they start getting spasms and all kind of radicular pain in their legs and their butt and such. And then after they get used to the medicine, just like the depression may get worse over time, they get used to the medicine and then they calm down. Other times they don't work at all and the person gets significantly worse. But if you just look at the side effects of both SRIs and SNRIs, the side effects are crazy and very destructive for some people. Some people are never the same. You can look at Cymbalta. There's different Facebook groups that say, one's called Cymbalta Ruined My Life. People have never been the same again. Some people have to taper off of these drugs for over a year just to get back to homeostasis, where they're not getting brain zaps and electrical pulses all throughout their body, and they're puking and their guts all messed up. You can look below and look at some of the side effects of Lyrica and Cymbalta. Even heart stuff is linked to Cymbalta, allegedly. But with that said, sometimes this can be what the client needs. They might be really depressed. They might have a lot of nerve pain. And people with back pain, generally, their mood starts to reduce. Their mood is somber. They get depressed. And what happens when someone is depressed? They have this posture. That's clinical depression. That's the face of clinical depression. People don't look at you in the eye. They're slumped and hanging over, bent over, and they've just succumbed to gravity and life, and they're just kind of checked out. Looking for the answer to your sleepless nights, sore muscles, and better overall well-being? If so, PowerAct Strength CBD has you covered. All of our products are made of CBD isolate and have 0% THC, meaning there are no worries of failing a drug test or the worry of feeling high. With PowerAct Strength CBD, we offer a wide range of products and payment options to ensure you have the option that best fits your needs. Don't just take it from me. All of our reviews and client testimonials on our site speak for themselves. You can even get 20% off your order by using code YT1306 at checkout. Go to poweractstrengthcbd.com to order now so you can get back to sleeping, recovering, lifting, feeling, and being better. And some people think that depression actually causes mechanical back pain. I don't agree that depression itself causes back pain. Can stress and anxiety exacerbate an already damaged back from a mechanical injury and overuse? Yes, I do think so. And it can increase inflammation and stress, and people can lock down and stiffen, or they might bend over, succumbing to life, and they might have a posterior disc herniation that the way they're sitting and being depressed can cause their pain. Or the other clinically depressed person that lies in bed all day and never does any exercise, they're going to get worse. And we know that discs swell when someone is supine or lying down. Their discs get nutrients at night when you're sleeping, but if you stay in bed all the time, that can actually exacerbate your back pain and make it worse. It can make the discs hyperhydrated and plump, and that can actually bow into nerve roots and push on nerves or the cord, and that can cause local pain or radicular pain just by hyperhydrated discs and such. There's unlimited ways to cause back pain. So yes, depression can exacerbate your back pain in many different ways. Here's something people aren't talking about. There is people that just stop taking these SSRIs and SNRIs, and you'll read, some have black label box warnings. Others to say, do not come off this, suddenly you have to taper off. Some of these people absolutely snap. Sometimes people feel better while they're taking these medications, whether it's for depression or for nerve pain, fibromyalgia, radicular pain, whatever it may be, inflammation, and they feel better and they just stop taking it and they don't taper, and their brain starts playing a bunch of tricks on them. Their pain will start coming back in waves. I've actually taken Cymbalta before a long time ago for nerve pain, and it was a terrible ride on the way up. The side effects that I had, everything got worse. I started feeling depressed while taking it, but then after about 3 or 4 months, 2 months or so, and then in 3 or 4 months, my nerve pain got significantly better and it eased it. But then after a while, it was time to come off when I was going through all that stuff with McGill, and coming off of it was hellacious. The side effects, the depression and anxiety, and then the return of different types of pains and feelings and thoughts and such. So I'm not saying that you shouldn't take medication from your doctor. I'm saying you should do your own research and know there's no such thing as free lunch. There's a price to pay. So bringing things kind of full circle, I don't think that someone that just has anxiety or depression will just cause their back pain, but it can absolutely exacerbate their back pain. And back pain can cause someone to absolutely become depressed, and the depression makes the back pain worse with the posture, with the stressing, with the lack of exercise, with sleeping all the time. Now, correlation doesn't mean causation. Correlation refers to a statistical relationship between two variables, back pain and depression, where they change together, but it does not imply that one causes the other, but they can have some causation there. Causation actually indicates a change in one variable directly results in a change in another, which is more difficult to prove than correlation. Sometimes, absolutely, this person's back pain has caused their depression. But I don't think someone's depression mechanically causes someone's back pain. But they can both absolutely cause exacerbation of back pain and depression. It ends up being just a never-ending tunnel of doom for some people. But the good news is you need an assessment. There is a way out. You need an assessment. You need to give it time. And I think that there are a lot of people that fall through the cracks and think that just medication is going to help them. Well, we need behavioral cognitive therapy. We need to learn how to move around the pain and move away from the postures and loads and movements that cause pain. Not sleeping in bed all day, going out, going for walks, doing things that you can do pain-free, and then eventually getting back into doing the things that you enjoy.
Hope you enjoyed today's video. Remember, like, subscribe, share, click the notifications because we drop videos twice a week. We also have a live stream every Friday where I answer your questions. Click below to see the latest video that we uploaded. Also, for our products, our CBD, our books that correspond with these videos, it's down in the description. For more information about all things Brian Carroll and Power Rack Strength, go to powerrackstrength.com. You can book a consult both virtually and in person with me. Enjoy your week, and thank you so much.